Hi everybody, I'm speaking with Dr. Rodrigo Castillo, who is a general surgeon and has his practice in Merida. And our podcast topic today is hernia. And now that I have the doctor here, I'm going to ask a couple of questions in English that are catered to international patients, and the answers are going to be very interesting for you to hear. If I'm planning to have a hernia surgery and I want to go to Merida, how much time do I have to stay in the hospital for that procedure?
At the hospital, you have to spend or to planning to spend at least 1 day. Not all the patients need the complete day. However, the normal amount of time is almost the whole day. So you have to plan the day you arrive, the day we perform the surgery, and probably a couple of days more just to rule out any complication in the beginning of the recovery, just to rule out bruises or anything surrounding the time of the surgery. After that, you can live in a safety manner.
If I'm here in Canada, the United States, or elsewhere, and I want to schedule a consultation, do I need to send you any pre-op documents or anything that you need? Or first I have to make an appointment, you have to determine if I have an hernia? What would be the whole process for it?
For the patients that are outside Mexico, outside Merida, where I am located, it's better to have some support with studies. For example, an ultrasound or a blood sample test, just to rule out any other diseases before coming here. However, it's not mandatory that you have to studies before. Probably we can talk about it and we can order after that. But in the United States and Canada, it's difficult to have it just because you want it. That's the thing.
Okay, so maybe if I have the hernia and I need to get the surgery, I can go like a couple of days earlier there so I can have some blood work and some ultrasounds and everything. So everything can be scheduled, just plan ahead a few days.
Yes. Sometimes I have a lot of patients also from other countries that I talk with them before, and we set the time to do the studies here before the surgery.
If I'm going to Merida and I'm going to get my surgery done, how much time do I need to get back on my feet so I can walk and travel home again?
Normally, we'll explain in a very technical thing. The complications of a surgery or the preoperatory period includes a couple of days, 48 hours, where you can have some complications in any surgery, no matter is an hernia repair or anything. So after 48 hours, you are in completely safe condition to travel to your home. You can walk, you can eat, you don't have any concern about any complication in the surgery, and the recovery could be spent in your hometown.
And do I have any stitches, or they're gonna absorb?
Normally nowadays I don't use stitches in the removable stitches. We use absorbable and some glues that are very, very useful because they remove by itself. They fell after a couple of weeks.
Well, thank you, Dr. Salas, for taking the time to answer the questions for our international audience. And thank you so much for watching.